Oncology.TV, delighted to have with us Ineke Lokker. She is an oncology nurse at the Erasmus Medical Center in Rotterdam in the Netherlands, and we are going to be discussing end-of-life care. Thanks for being with us.
Thank you.
So end-of-life care, what is your definition of it?
Definition of end-of-life care, there are different definitions of end-of-life care, but in my opinion it's about the last week, last days of somebody's life. So really the end part of the palliative phase.
I know you are passionate about end-of-life care. Where did this passion come from?
During the years I've worked up until now, the last 3 years I worked with head and neck cancer patients, and unfortunately a lot of those patients end up being incurable. And it struck me that the care you give, especially when patients have a lot of symptoms compiled on top of each other and interfering with each other, you see that it's really important that you can focus on those symptoms, that you know what symptoms are there, and that you also know what care you should give as a nurse. So I think that's one of the reasons why my passion for end-of-life care is born.
So in your work, you are looking to create evidence where you believe there is a lack of evidence.
Besides that, it's important that we also always tailor our care to the wishes of patients and the wishes of their family. I think it's really important that what you do is the best thing you can do, and that you mix the two things up so that you also always tailor it, but that you try to do always what's best for that patient in that situation. And unfortunately, end-of-life care is a field where it's a really big challenge to do actually research and to try to find the evidence that you need to evidence-base your care.
You are focused on symptoms in your research. Can you tell us more?
Yeah, I'm currently busy with a PhD in end-of-life care, and my focus is indeed on symptoms. And from previous research, we know a lot about which symptoms are present during the last days. And the challenge is how you can actually do research during those last days without burdening patients, without burdening the family, and without giving extra work to the nurses and doctors who are already really busy. So one instrument that is currently being used in a lot of countries over the world is the LCP. It's the Liverpool Care Pathway for the Dying Patient, and it's an instrument meant to be used multidisciplinary for the last days of life. So it's being used by doctors and by nurses, and you can use it in any care setting, so in a hospital, nursing home, home care, anywhere, hospice, anywhere where the patient is. And the care pathway, it exists of 3 parts. Part 1 is the starting point. You screen the situation, you look at the patient, you look at his family, and you see what therapies are you doing at that time, what interventions are you doing, does the patient know that he's dying? And you really sit down with each other and talk about what is actually useful and beneficial to continue, and what actions you probably should stop. And then in part 2, you 4-hourly register different care goals. The symptoms most present during the end of life are listed, and every 4 hours you look at them and you try to see, you rate them whether they are achieved or not. And with achieved, I mean you look at, for say, that is the patient without pain? Is the patient at ease? Is the patient bothered by troublesome mucus? So you screen the whole situation, look at it from every point of view, and not only the symptoms but also the surrounding. How's the patient doing? How's the family doing? And you keep on doing that every 4 hours until the patient eventually dies. And then you have part 3, which is meant to make sure that also the part after death is being checked for and being registered. And because there's already a growing use of that instrument, we hope that with that instrument we can get the right information to look which specific symptoms are present, which actions have been taken, which interventions, and what are the outcomes. And hopefully we can, with that information, eventually try to evidence-base the care that we give during the end of life.
End-of-life care is really a wide-ranging subject. It affects the patient naturally, but it also affects the family and it affects the caregiver.
Yeah, definitely, because I think the dying phase and the end of life, it's so specific, because a lot of things we do in life, you get second chances. You can do it over, you can change things, but the end of life, it's only once. And you want it to be good is not the right word, but you want the patient to be feeling as good as possible. You want to have family who are satisfied with the way how it goes, because it's for them the way they always look back at how the end of life was. So it's also really important for the family, but also for the caregivers, because at the end of the day, when the patient has died or when the patient is dying and you're satisfied or not satisfied with the care you give, you take it home with you.
Ineke, this is a powerful subject that you are tackling, and I wish you the best of luck in your work.
Thank you very much, and thank you for the opportunity for me here to bring this message.
Thanks for being with us.
Thank you.